record it. So there we go with that. So Ashley, if you could just go to the next slide, we'll go over some of the housekeeping things, I believe. And as you come on, like I said, please feel free to participate in the chat. But tonight we are going to kind of go over at first just an overview of the call, what you can expect out of joining today's call. We're going to talk a little bit about determination, our fundraising totals as of now, our Pace Setter program, shout out some top fundraisers from June and July. And then we'll dive into our mission, which today is going to be on our Voices study, along with a little bit of health equity. We'll also highlight one of our participants, Brandy, and talk about fundraising tips and open it up for some question and answers. So with that, before we dive in, I just want to ask everybody to please mute yourself if you're not already. And please feel free to put any questions in the chat or come off mute during the open Q&A sessions. We'll have two of them throughout the call. But like I said, very, very excited to have you all here. Ashley, do you want to go to the next slide, please? All right, so this is our August panel. I'm to the right. Like I said, my name is Ellie Gamache. I am a senior development manager here. I oversee our London and Berlin marathon teams. I previously oversaw our Falmouth Road Race, Hartford Marathon, Maine Marathon, and Bicycles Battling Cancer events as well in New England. I sit in Massachusetts, and I've also participated with DetermiNation for the New York City Marathon in 2022 and 2023. Down to the bottom left, we have Paul Purdy, who's our strategic director of endurance events. Paul is currently training for the Chicago Marathon. That's him doing Big Sur, I believe. You can see Paul in a lot of races, I feel. And to Paul's right is Brandy. Brandy is our ACS National Volunteer Endurance Lead. Brandy, remind me, what are you training for right now? Anything?
Disneyland and London.
Amazing. And then to Brandy's right is Jenna Capuzzo, who is an associate director of Cancer Center Partnerships here at ACS. She is also on our 2024 Chicago Marathon team as well as our 2023 team, and she will be talking about voices today. So that's who you can expect to hear from today. If you want to go to the next slide, please, Ashley. So I want to bring Paul off mute and let him kind of talk about what determination is. Obviously, we can read it here, but it's not fun to read a slide. So Paul, you want to give a little brief overview of determination?
Sure thing. Hello, everyone. I'm Paul Purdy. I'm the National Director for our endurance program. I also oversee Men Wear Pink nationally, which is why I am in a cave. And if you have any problems hearing me, let me know because there's a big party going on behind me. But we have the kickoff for the Pittsburgh Men Wear Pink tonight, and it's in a place where the Whiskey Rebellion happened. So if you have any historical interest, you can read about it, but that's why it's very dark down here. But determination. So what's that all about? Determination, I know many of you are here because you are marathon runners or marathon participants, but we do have some cycling events here. You see Bicycles Battling Cancer on the photo there. That's what Ellie used to staff, and now she's working on our Berlin and London events. But the Determination program is our overarching name for our endurance events here at the American Cancer Society. We have over 70 different events, and they run the gamut. We have our cycling events, like I mentioned, our marathon partnerships, but we also have had hiking and yoga. We've had tennis tournaments, swimming, kayaking, and all different types of things over the course of the history of the Determination program. What's really exciting is that we actually have two of the longest running events in the American Cancer Society's history are part of the Determination program. So the Chicago Walk and Roll it's going into its 54th year, which sounds crazy. And the Philadelphia Bikeathon is going into its 53rd year coming up soon. So it's Whiskey Rebellion, sorry. So it is it's a pretty interesting program because we also have the longevity of those events and some of our newest marathon partnerships like Disney and some new events that we've been adding in California. We have some new ones down the pike coming that are marathons all around the world in the next coming year. So stay tuned for those. So that's a little bit about determination, but let's go into some numbers too. So this is,
Next
I
slide,
forget
Ashley.
who's advancing.
Sorry.
Exactly. So here it is. We're very proud. Before the pandemic, we were on a trajectory to kind of hit the $10 million mark. We went back down almost half of that in the pandemic in 2020, and we've slowly been building back up. We have an $11 million goal this year. I anticipate us raising over 12 million this year, which is phenomenal because that's about $1 million to $1.2 million growth each year over the past 4 years. And that's all thanks to a lot of you fundraising and making your miles more meaningful as you participate and setting your goal and reaching it and raising your goal. And we thank you so much for that. So you can see where we are just financially. Something that we're really excited that happened last year in 2023 was we had our first team ever that qualified for the Hero of Research grant, which means that the team was able to actually name a grant, an active grant that ACS is fundraising. They're raising over $175,000 last year. So super excited for that team kicking the asphalt out of cancer. From the Pan Ohio Hope Ride that just happened a couple weeks ago. Our Chief Scientific Officer, Dr. Dayhut, was actually able to give out individual awards to all of those team members because not only was this the first time that we reached the Hero of Research Award, but it is probably one of the highest totals that we've ever had a team raise in the DetermiNation program. We're very excited to say that there's another team that's kind of on the heels of kicking the asphalt from the Pan Ohio Hope Ride that will be reaching the 175,000 mark very soon, as well with the Bond EY Pathfinders team. So very excited to kind of pass the torch from team to team at Pan Ohio, but we have this opportunity for all of our events that have teams for the ability to do that. So we can talk about that more on another time, but I'm super excited for that award as well. And then just next up, Ashley, we'll talk a little bit about our Pace Setter program. So we just talked a little bit about our team fundraising with that Hero of Research Award, and thank you to all of our teams that have participated. But we know that no matter what, when you are doing these events, you're doing them almost all individually. So we wanted to recognize that too, which is our Pace Setter program and our up and coming Pace Setters. So Pace Setter is anybody that individually raises $5,000 through kind of the event season. That can be through one event or multiple events. We do keep track of that to make sure that if you do multiple events with us, which many of you do, that if you hit that $5,000 mark, that we recognize you as a Pace Setter. We're really excited when you think about it. We have about close to 20,000 participants annually. But when you look at these numbers, right now we have just over close to 600 people that are raising about $3.3 million, which is, if you remember our slide before, that's a lot of money out of that 7.3 that we've currently raised. So very excited for these two groups. A small amount of people raising a ton of money, and we're very appreciative of them. But we also want to recognize those people that are in the range of becoming an up and a coming Pace Setter, as well as a Pace Setter at the $5,000. That we hope that you can join us. We love to shout out our Pace Setters on social media. We list our top kind of 20 fundraisers for each year. Our teams and individuals on cancer.org/determination. So we love to shout it from the rooftops. We know that you guys put in your blood, sweat, and tears for training as well as fundraising, and we really appreciate it. So anything that I didn't cover, Ellie, that you would like us to talk about?
No, I think that you hit the nail on the head. I definitely encourage everybody to check out our Pace Setter program if you're definitely close to achieving that threshold. It's an awesome opportunity to just get some more exclusive communications and features and whatnot. But those numbers are just incredible in my opinion. So, question in the chat, Paul, is Pace Setter new? How long has Pace Setter been around?
Sure. So we started it in 2018, and we had one for cycling and we had one for running, and they were kind of separate, different thresholds. In 2021, we decided to move them together and make that number 5,000 for both. So it was there in 2022. So if you missed something, there's a couple emails that come out for the redemption for these items. If you know that you reached it, and we can definitely make it whole for you if you didn't get that item. But also, if for some reason you missed the email, it comes through a couple times throughout the year to remind you to redeem. But your staff partner can definitely make sure that you get that redemption for the Pace Setter item if you were not able to do that in the past. But if you are if you have been a pace setter this year or the past 2 years, check your email soon. We're going to be sending out a newsletter to all of those people that kind of were in that past couple of years and this year pace setters. We have a survey because we want to know how to make it better and make it well known of what we're doing with pace setters, and then also just some kind of tailored news for you. That's hopefully coming out middle of next week.
And then Paul, I also just got a question that I think is a good question for the group as a full. Is there a deadline for to reach the 5K?
Yes, it's a kind of complicated because we do it based on your event season. So if you read the small fine print on the bottom there, we recognize that most of our events, so take some of our ACS owned and operated events, like our cycling events, those typically happen in the summer and we start registering again for next year. So basically, you can start fundraising for the event, but it's based on when the actual event happens in that calendar year. So if your event happens in February of 2024, you probably had most of 2023 to raise that money, but we're going to recognize you in 2024 for that piece. So it's based on kind of when you start fundraising for that event, but it's essentially whenever the event takes place in that year.
Cool. I'm not seeing any other questions on pace setter. So Ashley, if you want to go to the next slide, that'd be great. All right. So here's some of our June event. Oh, these are all of our June events actually, and the top fundraisers. So we did want to just shout out everybody. You may have seen these graphics on our social media, but June we did have a number of great events, a triathlon, bike ride, walk and roll. I think you can rollerblade. So a little bit of everything. And then of course some running races as well. So if you see your name on here, if you're on the call, congratulations. And thank you so much for all of your hard work and your efforts. I believe the next slide is July. And so we have the Pan Ohio Hope Ride and the Boilermaker Road Race in New York. And is it Bond DUI Pathfinders? Is that the right? Yeah. So that was what Paul was referring to as kind of the up and coming team that's getting close to get that Hero of Research award. So that's very, very exciting. But once again, thank you all for your hard work and your efforts. You're truly making a difference in the lives of so many people. So thank you again. Ashley, you want to go to the next slide? All right. Jenna, I believe, should be on the call. So, Jenna, if you want to come on camera. I will say before we dive into Jenna's mission chat, one of the reasons we wanted to put this call series together was to give everybody who participates or is thinking about participating an opportunity to, whether they want a fundraising tip or whether they want mission, it's a place for everybody to come together, connect with the DetermiNation community from across the country, hear a little bit about what we're doing at ACS, where your fundraising dollars are supporting, as well as giving you that support that you may need for fundraising. So with that, tonight's mission chat is all about voices, which falls into our health equity work. Like I said, Jenna Capuzzo is our host for this segment. She is an associate director of Cancer Center Partnerships here in Boston, actually, so I get to see Jenna quite a lot. And she is also running the Chicago Marathon this year. She did run it last year as well, but I believe this year she's running with her siblings, which makes it even more special. Jenna, I would love to just chat before we get into the mission part about what you kind of just do here at ACS and why you've chosen to participate with DetermiNation, and why Chicago.
Yeah, absolutely. Thank you so much for having me tonight. As Ellie said, I live in the Boston area. I see Ellie frequently. It's very lovely. I have yet to get to one of her run clubs, though, in New Bedford. I will really try hard to get there.
One day.
But I started out like all of you, as a volunteer. I started Relay for Life in high school and then quickly found DetermiNation as something that I had a passion for. And, I had this bucket list item since I was little of running a marathon, having watched my dad run several. And then I had 7 knee surgeries and was like, I'm never going to run a marathon. So that's kind of out the window. But then I found DetermiNation and found the community that it kind of brought everyone together under the umbrella of, fighting back against cancer. Obviously, I've been touched by cancer in my my life. So it's really wonderful to kind of find a community to give back, but also to kind of reach my goals. 6.5 hour marathoner here, no complaints. I said I got every minute out of Chicago last year, and I had the best time and roped my siblings into doing it this year. And we actually just hit our fundraising goal last week, so we're very excited about that. Our shirts are in the mail this week.
I just got yours this morning.
Perfect. So we're very excited to run our marathon. But how I kind of got involved with working for ACS was a couple years ago. I was working in the hospital world and had always been a volunteer for ACS and kind of shifted my focus a little bit to wanting to work for ACS. So I work in the patient support pillar, which is a little bit different than our events pillar, but what I tell people is I spend our money, and it makes me very happy to spend the money that we all fundraise, as a fundraiser myself. So I get to spend the money and do some really cool work, whether it be with the Hope Lodge, with our grant programs, or with research projects, such as Voices. So it's really exciting to kind of work with our hospital systems and use our money, to really make a difference in communities. So what I get to do is, we always talk about where does the money go at ACS, and I can probably talk till I'm blue in the face about all of the different things that it's going to. But I'm really excited to focus in on specifically health equity and voices, because I think this is a very special project that's going on here at ACS.
Great. All right, I'm gonna head on mute and let you take it away.
All right. So feel free to put any questions in the chat or save them to the end. I will try not to get distracted by the chats that pop up, but we'll answer everything as it comes along. So I am here to talk to you all about the Voices of Black Women study. So this study launched in May. So it's very new to ACS, but something that, we've been working on behind the scenes for a while now to make sure that this gets launched. So if you can go to the next slide. Figured I would just kick us off with our vision and our mission. So our vision is to end cancer as we know it for everyone. So we've been doing this in a variety of ways through a variety of studies. I'm sure many of you are familiar, and if you're not, I'm happy to share more information about them with the CPS studies. So we've been doing research studies for many, many years. And ACS has kind of seen an opportunity to expand and to make sure we're really hitting that for everyone, bolded there, because this is something that is really important to us, especially given that cancer touches everyone. Our mission is there as well, which is to improve the lives of people with cancer and their families through advocacy, research, and patient support to ensure that everyone has an opportunity to prevent, detect, treat, and survive cancer. So you go to the next slide. Just share a little bit about the history of research that we've been doing through cancer prevention studies. So as you can see, we've been doing studies for over 70 years. We have done this with over 2.5 million people. So in addition to funding research, which ACS does, we are also a leading research institution. So that means, we fund external research through new and upcoming researchers who are established in the field, but we also do our own research internally. And that's where this study kind of comes into play. So we've done some of the largest population studies over the past 70 years, and ACS is really in a unique position to do that. We have that national brand, we have that reach across the United States and beyond, although our CPS studies have focused here in the US. And it's really exciting because it gives us an opportunity to make a difference, especially in the cancer scope. We've worked with, as I said, over 2.5 million participants since 1952. So basically, when participants join any sort of ACS study, they're consenting to provide information over time. So a cohort study, for anyone who doesn't know, is a study of people over time. So many of the CPS studies have been around 30 years. So we are currently in the CPS 3 study, which was, I believe, the early 2000s when that one started. So that one is still ongoing. And many of my colleagues that I work with are enrolled in that study and providing information, health information, so that ACS can learn about all of the different factors that influence cancer. And in a couple slides, I'll share about some of the data that's collected and shared with the research team. ACS population cohort studies have also generated a wealth of knowledge on risk, prevention, and survivorship, and they have published thousands of papers in reference to the studies that have been done. So overall, basically, the flow of a cohort study is they consent to a large group of cancer-free populations. So that's all the studies we've done so far have been on cancer-free populations. They collect data, sometimes specimens, so blood, and then follow them over time to track the data and see how it changes, and then publish the research. So if you go to the next slide. So now we're kind of noticing, having looked at the research, that we're in a unique place to launch the voices of Black women. So we know that there is always work to be done, and noticing that predominantly a lot of our studies have focused on the white population. So this is a unique opportunity for us to kind of study a specific population where we know that there are disparities impacting women of color. So both in incident and mortality rates. So as we know, Black people have the highest death rates and shortest survival rates of any racial or ethnic group in the US for most cancers. So this study is an opportunity for us to kind of make a difference and actually, back our words, end cancer for everyone. And through this study, we're hoping to better understand why Black women in the US are facing worse health outcomes to kind of intervene and make a difference in that space. So if you go to the next slide. So engaging Black women in research is key to improving Black women's health. We know that Black women are less likely to participate in clinical research. This is due to historical research in the United States. Obviously, there is a mistrust from previous research that's been done. So we're trying to create a space where we're re-engaging in a way that creates that trust and community to make a difference for these women, and to make a difference for their children and their children's children, as we have done through the CPS studies. A limitation of our last studies has been a lack of engagement of non-white participants, and ACS has noticed that. While we enrolled a large number of Black women in CPS-3, more than any of the other studies, there is still a critical need to get information on this population to truly make a difference. To help close this gap, the Voices of Black Women study is the largest ever population study to understand the health of Black women. Well, it's not the first, it is the largest. So there have been a few other studies that have gone on to kind of address health in Black women, not specific to cancer, but including cancer as well. So the primary goal, as it says here, of Voices is to understand why Black women get and die from cancer, which can help inform strategies to improve cancer prevention, treatment, and survivorship. If you go to the next slide. So what are we doing? We are trying to enroll 100,000 Black women across 20 states. And these 20 states were identified as having the largest percentage of Black women living in that state. So that's the reason for the focus of the states. So as you'll see here in yellow, those are the states that we're currently recruiting in. Many of which are in the South or in the East Coast, but still recruiting within there. The study, as I said, launched on May 6th, so it is fairly new. So it's been a couple months now that we've been launching in various areas kind of strategically. We've started out and we're building out as we launch in areas. So for example, here in Massachusetts, we started in Boston and are now currently expanding into Springfield and Worcester, for those of you who are familiar with Massachusetts. Who are we recruiting? So we are recruiting Black women between the ages of 25 and 55. With no cancer history except for basal or squamous skin cancer. And they have to reside anywhere within these states. So a very, very basic recruitment. We do have a eligibility survey that anyone can take quickly before they fill out all of the information that's needed to join the study. So that will help inform whether someone is eligible or not to join the study. And then we will follow up with the formal process. So if you go to the next slide, before I get into what enrollment looks like, I just wanted to share the research team. So even though we are enrolling in all of these states, we do have a team that's dedicated to leading this research. It is led by a team of researchers who represent diversity through experience and thought. The leadership team is led by Alpa Patel, who's led many of our studies before, with a really wonderful group of women here at ACS who have been super awesome to work with over the past couple months as we've launched this study and have really a critical eye for, what's needed and how to go about this in a very culturally sensitive way, understanding, where everyone's coming from, especially as it comes to research. So if you go to the next slide, I'll just talk through what enrollment looks like for someone who might be interested in joining. So as I mentioned, there's an eligibility survey. This takes about 5 minutes. It's really those basic questions of, are you between 25 and 55? Have you had cancer before? Do you live in one of these 20 states? Followed by an informed consent. So making sure that anyone who's enrolling in the study knows what's involved and understands what participation means. Then there's a registration survey. It's about 15 minutes to really get contact information for everyone so that, in case anyone moves while they're involved with the study, they're still able to contact them and follow up with them. Everything is done through an email and an account that they set up. And then there's the main part of the survey, which is the life and health history. So this really is going to go through a broad range of topics of what a Black woman is experiencing in her day-to-day health or day-to-day life. And I'll share some of the topics on the next slide of what that looks like. But that is really the main chunk of what the survey is. And then what does the study mean for someone who's involved? It is really 2 surveys a year, only about 30 minutes each, just kind of following up on to see if there's any changes in any of the information that they provided in the initial survey. So every 6 months, they'll be emailed a survey, any participant, and they'll fill it out. There is no specimen collection. There's no required meetings or anything. It's filling out a survey every 6 months for as long as they wish to be enrolled in the study, and they can unenroll at an ending point. So if we go to the next slide. These are some of the topics that are covered in the health and wellness survey part of the survey. So, standard content, demographics, insurance, healthcare, family history, occupation. So that's very standard for all of the ACS studies. Those are involved in the CPS studies as well. And then behavioral health and behavior and lifestyle information. So alcohol and tobacco use, diet, environment, sleep, personal care product use, a variety of different components that tie into behavior and lifestyle are asked through the survey as well. Again, those are all included as well in the CPS surveys. So that's all very similar to anyone that's participating in any of our CPS studies. And then the new components that they've added into this address mental health, quality of life, stress, racism and discrimination. So more components to try and get at what actually might be influencing the worst health outcomes that Black women face. So it's really kind of doing a deep dive, trying to figure out what is the root cause and how can we intervene and make a difference. So if you go to the next slide, this is my call to action and the reason that I'm here tonight. And this is how can you get involved? So you've heard me talk about the study, what's involved, but you might be thinking, I'm not eligible for the study. So that being said, if you are, join the study and fill out the eligibility survey. You'll talk with one of the research team members as part of the informed consent to learn more about the study. If you're able to, this is a really great opportunity for you to kind of share some information. So please enroll if you're able to. If you're not able to or not eligible, share about the study. We have a plethora of information to share out, whether it be on LinkedIn, on Facebook, with your networks. We have flyers, we have recruitment cards. You could bring them to a job, share them out kind of in any space. We're really trying to get this out there in front of people and talking about it and why it's important. And then discuss engagement opportunities. So all of your events have staff partners, and all of your staff partners know about the Voices of Black Women study. So if it's something you want to incorporate into an event or something you want to use as part of your personal fundraising to share out information about it, there's a ton of information available, and your ACS staff can help share that as well. And I'll drop my email, so if you have questions about it, you can ask me too. I'm happy to share any sort of resource that you're looking for as it comes to voices. become an ambassador. So, what is an ambassador? We're also recruiting ambassadors, and these may be people who aren't eligible to enroll, but have a good connection, or maybe they're outside of the age range. Maybe, you've had cancer before, so you're not eligible, but you want to talk about this study to the people in your life that you want to enroll. So, we have an ambassador opportunity. To become an ambassador, it's about a 15-minute training. It's the same training that all the ACS staff got, as it pertains to voices. As much as we all would love to sit in a room with Alpa and learn about it, we were not able to do that. So she did provide us with an online training. So you can take that training and you can become an ambassador. You get a really cool t-shirt. I think you get a mug that says voices, perhaps a button to wear out in public. And you can be a voice of the study as well. So you can help us spread the word, join us at events, and share about voices. And then just learn more about it and educate yourself. So we have the voices.cancer.org. That's where all of the information is housed as it pertains to voices. And then you can go there. There's a really comprehensive FAQ there. I refer people to it all the time. It's really wonderful. And then those are kind of some really cool ways to get involved. And, as you're fundraising, this is now an opportunity for you to say, where does the money go at ACS? Well, it's funding this really cool project in health equity where we're trying to improve the health outcomes of Black women. So now you have all of this information under your belt to share with people. So if you just go to the last slide, this is the QR code that is available to it links to the voices.cancer.org so you can learn more information about voices. But again, I put it on there, I put my email on there. And then thank you for helping to end cancer as we know it for everyone. I know as a fundraiser myself, I love to talk about what ACS does. So hopefully this is one more thing in your tool belt as you're talking about where the money goes.
Thank you, Jenna. If anybody has any questions, feel free to drop them in the chat or come off mute. I know that can sometimes be a lot of information, but like one thing Jenna said, I think that is so important is using your event right now and your fundraising to also help push out things like this. Putting out a LinkedIn post saying, did you know that the American Cancer Society is running this study? And then maybe a link to your fundraising page. There's so many opportunities like that as well with our tangible giving statements as well, what $10 can provide, $15 can provide. So really throwing the mission into your fundraising is so crucial. Jenna, one question that I came up with for you that and there's also a question in the chat. So I'll go with the chat first, actually. Do we know how many women are currently in the cohort?
I don't have the exact number, and I knew someone was going to ask, but I know that it is above 2,000 and below 3,000. So it's somewhere in the 2 to 3,000. So I'm going to say we're 2% of the way there, which is huge because we did just launch, and it does take time to enroll 100,000 people in a study. So we're between 2 and 3,000, but I can get an exact number for you, Megan.
And then I think an important question is, to help with recruitment or to be an ambassador, do they have to live in one of the study focus states?
No. So you can be an ambassador from any state, which is really exciting. I personally have a friend who lives in the Midwest, and we're in a state that we're not recruiting in, but has a really large network from college in a state that we are recruiting. So they're enrolled as an ambassador, and they're able to kind of share out information about this so that their networks can still see what's going on. So you don't have to live in a recruitment state to be an ambassador. So I also think of New England. Massachusetts is the only state enrolling in New England, but we touch all of New England. So we do have ambassadors who are from those other states and just want to help and share the word. So it's really exciting. You can be in any state to be an ambassador.
Awesome. And I don't know if you know this, but maybe you can dig it up and we can come back to it at the end. But do you know which state or area has the most women left to recruit?
So that's a little bit of a tough question because every state kind of has a different goal of how many women they're aiming to recruit to ladder up to this 100,000 women. That being said, once we hit our 100,000, we're excited and we're ready to go with that information. But I will take a look and see if I can kind of look at percentages of who's doing well and where some extra help could be needed. Because I know that I will always welcome help here in Massachusetts. It is a big undertaking here in the state, but I will take a look at the numbers and see where our recruitment is going. We get like bi-weekly updates on where where we're successful and heading into, strides is coming up. We're really excited as for an opportunity there. And then with all the determination events coming up, we're hoping to kind of get some more recruitment through that.
Awesome. Any other questions for Jenna that we can answer to help you understand the study, to promote the study, or just to help you out with your fundraising tying into the mission? All right. Awesome. Great. Well, thanks again, Jenna. And I'm sure I'll see you, but good luck in Chicago. Congratulations on your fundraising. Ashley, could you just go to the next slide? Oh, we are past that. All right, moving on. All right, here is our participant highlight with our fundraising tip today. I am super excited to bring Brandy Myers in to kind of talk about her why, her fundraising, why she's a part of DetermiNation, and whatnot. So currently, Brandy is the ACS National Volunteer Endurance Lead for Team DetermiNation. She's been a part of DetermiNation since 2011 and has also been a part of the West Suburban Chicago, which I did not even know existed until I read this last week, and the Run Disney committees. So Brandy is super involved with DetermiNation. I'm very excited to let you all hear from her today. So welcome, Brandy.
Thank you very much.
Yeah.
I
Ashley,
unmute myself correctly. Good.
yeah, you're good. Ashley, could you just go to the next slide? So before we get into the fundraising tips, I love this picture of you. I would love to just have you chat about why you chose determination. What drew you in?
Oh gosh. As you mentioned, I've been a charity runner for a little bit. Actually, as you mentioned, yesterday actually was my 13th anniversary of my first Run Disney race. So it's kind of timely that this was today because I had all those wonderful Facebook memories popping up about what it felt like to be running my first half marathon ever, and to doing it with an amazing charity. When I first started running, I started training for my first half marathon, and I was like, oh, this is nice. I go out and I run, and nothing really feels all that fantastic. And if any of you saw the video that we did for Run Disney, I actually talk about my story a little bit. I was kind of bored with the training and really kept wondering why. This is, okay, I can go out and I can run, I can walk, whatever. But, and literally that weekend, I got an email that said, do you want to make your miles more meaningful? The power of a cold email. Who knew? And I said, yes, I do. I thought about my aunt, my uncle, both my grandfathers, my cousin. And over the years, the people that I run for has grown to fill my back with ribbons. I've started just doing their names on a bib because it's just easier. And the one thing that really drives me is, running you kind of do on your own. With ACS, it's really a community and a team. And it's brought some people into my life, a couple who are on this call here, who I really can't imagine living without. So not only do you get a team and your running makes a difference, you get an additional family, which a group of people who know what dealing with cancer is a difficult thing for others to understand. But, every cancer, every life, unfortunately, that makes our population very large. I don't know anybody who hasn't been touched by cancer. So it's made the ability to those long training days, those long races, to have a reason behind it. I think my favorite moment, I was doing Ironman Louisville, and in the middle of the run, you stop and you pick up your gear bag, and and I keep my angel list with me there of all the people that I'm running for. And so I was 13 miles in, and I just started bawling, which makes running a little harder, but it was the one thing that kept me moving forward. And all of a sudden, those people that I was running for were the ones who were lifting me up. And there is nothing more meaningful than being with your family, even in your hardest moments.
Thank you. Oh, yeah, so true. Um, Thank you for sharing. And I just want to highlight this picture of Brandy and then the one on the next slide. Ashley, you can go back to the next slide. Um, Brandy participated and I don't even know what the official name was, but it was 7 continents in 7 days, 7 marathons, which is, and she represented determination doing this. And I think that is just the coolest thing ever. I remember starting here at ACS and hearing about this, and I was like, what the heck is wrong with her? But then I did my first marathon with
The list is
determination and I
long,
got
you
it.
know. It's,
And it's just amazing. So cool. So, Brandy's done her fair share of fundraising. So I wanted her to just highlight a few tips. I know we're kind of cutting it close on time, Brandy, but I'd love for you to talk about, what's been successful for you leaning into your strengths and your resources. I know you have some things you'd like to share.
yes, definitely. When I first started as a charity runner in 2011, social media was the easiest way to get money. And as the years came by, social media became less and less of a sure thing. We'll call it that. It used to be so easy. You posted your fundraiser and the money came in. And then I really learned that you really need to make it personal. So I really want to encourage you into leaning into being your authentic self. It, this will be the one thing that will connect you to the people and will allow people to share in your strengths. Please still use social media. I do it all the time, but use direct messaging and tailor it to each individual recipient. Please don't do a mass email. Nothing will get deleted faster than a hi, friend, because you know what you look like, what you see when you see those come in. You're like, okay, fine. Introduce yourself, say, a personal touch. Oh, hope your kids are doing great. What about your cat? Here's this amazing thing that I'm doing. I really want you to be a part of it. Make a list of names of people that you can reach out to, and don't just do it once. People, I think the research is showing you need to ask somebody 3 times
Yep.
before they even will really kind of sink in. Also, are you a baker, a crafter? Please use your strengths. I am, to be humble, make the best chocolate chip cookies in the world. And when I ran my first marathon, and I see some of you are doing Chicago, that was my first and will still always be one of my favorites. Asked for a donation of $26.20 for a dozen cookies. I was in my kitchen forever, but it was so much fun to be baking cookies. People love to get something for a donation that they're giving. I have friends who are crafters who do Disney ears, stickers, anything you can think of. And check out tools in your area. I see my beautiful friend Karen who does Cans for Cancer. Um, do you have friends or family who are willing to give you their garbage or their recycling? I'm sorry, their recycling. People will give you their recycling if you live in a state that pays for this. And I know Karen does an amazing job fundraising for all of her Disney races, including Dopey, which is no small donation amount. Um, and my personal favorite, and this has really been my go-to the last couple of years, is selling things that either I or my friends or family don't need anymore. I first started with garage sales, but then I've really slowly transitioned to selling things online. I can have people either pay me directly or directly into my fundraiser. Then they get their donation. They get their item and their donation. I completely funded my Disneyland bit by doing this. And last week, I raised $100 in an hour by selling annual pass holder magnets from Disney that I got for free. Now, how easy is that? It didn't cost me a penny except to mail the things out. And finally, you're doing a lot of running in your training. Use your training and your race by asking people to sponsor miles. When I do my 20-mile run, I ask people to sponsor the miles. I write their names on my arm. Usually it's all sweated off by the end or on my face at some point. But you can stop and take pictures along the way. When you're doing a race, the earlier miles, usually maybe like a $10 donation. When you get up to the 20-miler, go up to 25, 35, 50. That way, people are invested not only in your race, but also in carrying a part of you along with them. So make your experience a shared experience with those who are support. And that way you get not only your fundraising, but you get a built-in support and cheering section. Whatever you do, there's so many opportunities out there. Be you. People know when you're being inauthentic. Please be yourself. Be the biggest salesperson you can be. Use the resources on acsresources.com. We have graphics, we have fundraising ideas. And almost all the races have great Facebook pages. Engage with your fellow runners on what works for them, other ideas. There's no one right way to do fundraising. The one right way is the one way that works for you. So above anything else, be proud in what you're doing. That energy, that passion, that's going to come through and it's going to be infectious to people. So thank you so much for everything that each of you are doing. You are showing what a difference one person can make in the world, and you're doing it all to make an impact against for every life and every cancer. And what else can we ask for with an individual?
Exactly. Thank you so much, Brandy. And I love everything you said. Most importantly, be true to yourself and your personality. If you can't make your fundraising personal, people will pick up on it and utilize those resources, your network. You never know what bar manager or restaurant manager would be willing to host a fundraiser for you. So definitely lean into those strengths. I love that. Thank you again. Any questions for Brandy, please feel free to come off mute or put them in the chat. But with that, I think we're going to go to the next slide and start to wrap this up. So before we head out, our hopes and our dreams for this call is to be quarterly. So we hope to have another one in December if all works out. So I wish I could fit all of the events between now and then in here, but I couldn't. So I did August, September, and October. This weekend we have our Falmouth Road Race here in Massachusetts. So super excited to cheer on. We actually have a DetermiNation staff member participating in that. So good luck to Libby. And then we have our other side of the country, Fighting Cancer to the Coast in Oregon. September, we have a hiking event in Arizona, the C2C relay run in Ohio, Philadelphia distance run, which Ashley, our screen sharer, will be participating in, Cycle to South Hope Ride in Tennessee, Bicycles Battling Cancer in Massachusetts, Soul Burner Chaseburg in Wisconsin, Boulderthon in Colorado, and the Berlin Marathon in Germany, which I know so many of you on here are participating in that as well. And moving into October, we've got the Long Beach Marathon, Twin Cities Marathon, Maine Marathon, Chicago Marathon, Detroit Marathon, Marine Corps Marathon, and the Dublin Marathon. And of course, November, we will have the New York City Marathon, as well as the Disney Wine and Dine event, and so many others. So if you are participating in one of those, good luck. Please put it in the chat. We want to congratulate you. We want to celebrate you. Share your pictures with us on DetermiNation on social media so we can celebrate you. But with that, please go to the next slide. And any questions or comments? I know we went a little bit over, but any comments, questions, we want to hear all your feedback. If you don't want to put them in the chat, feel free to email me. I will put my email in the chat if you're interested in being a highlighted participant on the next call. There's a mission topic you want to hear on. Please let us know. You are our guinea pigs. This is our first call, so we want to grow from here. We want to get this DetermiNation community together and give you this forum to get to know one another. But if there are no questions or comments, I will let you all go. But I genuinely very appreciate from the bottom of my heart for everybody that I run for and I work here for. I thank you in their memory, and I know on behalf of the whole staff here at ACS, we truly appreciate everything that you're doing for us. So I hope that you all have a great night, and thank you again for joining us.